My name is Marlene Schweider, and I'm 54 years old.
Marlene, what did you come to me for originally?
Because I had so many symptoms, stomach aches, pain in my abdomen, joint pain, headaches, waking up with headaches every morning, dry hair, brittle fingernails, and the list just goes on.
What was your diagnosis that the medical doctors gave you?
I was told that I had hypothyroidism, and I was on medication for that, and it worked for maybe a year, and it quit working, and all the symptoms came back.
Were you autoimmune thyroid, Hashimoto's, thyroiditis with the antibodies?
I was told I had hypothyroidism, and that's what I was treated for.
Okay, and then we ran a test there, and we found out that your body was making antibodies to your thyroid.
Yes.
That's okay.
Yes.
So that's Hashimoto's, and we've been treating you now for how long?
I've been coming here for about two and a half months.
Okay. How much better do you feel? And we're not even done yet, okay? Because I tell all my hypothyroid patients it takes about 6 months to a year, right, to really achieve maximum benefit from what we do. But how much better after 2.5 months do you feel now compared to when we started?
How much? Well, for the first time in years, I've been sleeping at night. The pain that I had in my side 5, 6, 7 days a week, severe pain that went all the way through to my back is completely gone. My stomach doesn't bloat anymore. I've actually, for the first time in about 5 years, lost about 5 or 6 pounds. And I'm excited about that because it wouldn't budge. I don't have the headaches anymore. The joint pain is much better.
Now, we found on some lab tests, right, some things that were wrong. Food sensitivity-wise, what did we find? They were sensitive to?
Severe sensitivity to gluten and dairy, and there's a little bit with eggs and yeast.
Okay, so you've been eliminating those from your diet.
Yes.
And be honest, it's a little hard at first, right?
It is very challenging.
Okay, but it's getting easier as you go throughout, right?
This is what I tell my husband. I've said, I've given up so much. I've given up side pain. I've given up bloating. I've given up headaches. I've given up being exhausted and tired all the time. And to me, it's worth the food that I've had to drop out of my diet.
And I will tell you this, it's going to get only easier as the months go on. You're going to learn how to substitute different foods. It won't even be an issue in a little bit. Now, in your gut now, did we find some infections in your gut with the test that we did?
The test showed inflammation and some infection.
Okay, and so we've been addressing that also too through natural methods. You haven't had to go on any medication for that, right?
No.
Okay, now what were your doctors telling you? You've suffered with this for many years. What were they telling you?
Yeah, my first doctor, my family doctor that I went to, after I explained to him I was concerned about my thyroid because I found out thyroid conditions run in my family. After we talked, and he looked at me and he said, well, obviously you've done your homework on the internet, and he seemed to feel that I was maybe depressed and that he wasn't very supportive at all. And he did a very basic thyroid test and diagnosed me with fatigue.
Okay.
Which is why I went to him in the first place.
Right.
Because I was fatigued.
Okay. So the only thing they really had to offer you was different medications and things of that nature. Now, you know that you've had to, now the insurance doesn't cover our program entirely, right? And you had to pay, fair amount of money. Is it worth it?
It's been a fair amount of money, but it's a sacrifice that's well worth it. I did end up, because of my condition that I wasn't aware of, having my gallbladder removed last year, and I paid almost as much money, even with the insurance benefits, to have that done as I have to become healthy and get my life back.
And what I tell all my patients, the money that you have to spend for our program, over the years you're going to save with less medication and lost work and all of that, so let alone quality of life. So you would recommend our program to someone with thyroid issues?
Absolutely.
All right. Thanks, Marlene.
Okay.